Peace upon all, my dear medical students. In this lecture, we will explain the histology of the cardiac muscle and the blood vessels. Let's start by learning objectives. Number one, to recognize light and electron microscopic picture of cardiac muscle. Two, we're going to explain the structure of the wall of the heart. And then to differentiate between the cardiac muscle and Purkinje fibers. The fourth objective, the comparison between medium-sized artery and vein. And then we will describe the structure of the large artery, elastic artery aorta, and large vein, inferior vena cava. Last objective today subdivides capillaries. We have three types of capillaries. Let's start. The first content today, light and electron microscopic picture of the cardiac muscle. The cardiac muscle by light microscopic examination. I have the shape of the cardiac muscle, diameter and length, striations, nuclei, and sarcoplasm. Starting by the shape. Cardiac muscle is short cylindrical cells separated from each other by dark staining disc. We call it intercalated disc. Don't forget, intercalated disc with extensive branching and anastomosing. The diameter of cardiac muscle 25 micrometer. Length of cardiac muscle is highly variable from 85 to 100 micrometer. It is surrounded by connective tissue containing blood vessel and lymphatic. Striations within the cardiac muscle is present, but striations are irregular and less distinct than the skeletal muscle. The nuclei of cardiac muscle large, oval, and central in position. Cytoplasm, or sometimes we call it sarcoplasm, granular sarcoplasm, acidophilic, as we see in the diagram, reddish in color, so it is acidophilic, contains glycogen granule, lipid droplet, and lipochrome pigment, which increase with the aging. Look at this diagram. This is microscopic examination of the cardiac muscle by light microscope. Here you will find the nuclei, oval, large, central in position. Striations are less distinct and irregular than skeletal muscle. If you closely observe this area, this dark disc that separates one cardiac muscle from the other cardiac muscle, this is called intercalated disc. Intercalated disc. By electron microscope, the cardiac muscle fibers contain mitochondria, cardiac muscle rich in mitochondria, Golgi apparatus or Golgi sacules, and glycogen granules. If we closely examine and investigate the structure of intercalated disc, we will find that it is a site where two adjacent mast cell fibers are joined together. The intercalated disc contains three types of junctions: fascia adherent, desmosome, gap junctions. Please don't forget the gap junction. Gap junction allow the heart to work as a syncytium. All cardiac muscle fibers are connected together by gap junctions. So all nutrient, all requirement, any stimulus can pass from one cardiac muscle fibers to the adjacent one in 1 minute in a rapid manner. So the cardiac muscle work as a one unit. We call it syncytium. Rich in myofibrils. This is the cardiac muscle fibers. But the myofibrils here less irregularly arranged than skeletal muscle, and giving less regular striations by light microscope. Look at the electron microscopic examination. Here the arrangement. You will find numerous mitochondria encroaching on the striations of the myofibrils. Here you will find the intercalated disc, zigzag-like disc located between two adjacent muscle fibers. It is formed of cell junctions. We have three types of cell junctions here: occludent junction, desmosome, and gap junctions. The most important one is the gap junction. We will continue here the cardiac muscle fibers by electron microscope. No triad present only in skeletal muscle, but in the cardiac muscle we have dyad system. The dyad system, which is more in the atria, is formed of one T-tubule and one terminal cistern. One T-tubule and one terminal cistern. Please revise the triad in the skeletal muscle. Triad in the skeletal muscle has different structure than that and different location than that. T-tubule surrounding the myofibril at Z line and terminal cisternae also present at the Z line. So the dyad present at the Z line. Compare here, or the comparison here between skeletal muscle and cardiac muscle. Skeletal muscle, I have a triad system. If you count here, you will find three structures. And triad system located at the AI junction between actin and myosin junction here. AI junction. Another triad system at AI junction. On the reverse, the cardiac muscle, we have dyad system. Yes, this is the T-tubule, and this is the sarcoplasmic reticulum. So I have dyad, and the dyad located only at the Z line, of sarcomere. So one sarcomere in a skeletal muscle has two triad system, while one sarcomere in the cardiac muscle has one dyad system. Structure of the wall of the heart. The wall of the heart is formed of three main layers. Epicardium from outside, formed of simple squamous epithelium, like the peritoneum, like the pleura, like the tunica vaginalis of the testis, simple squamous epithelium. Endocardium also formed of simple squamous epithelium. Endocardium lines the wall of the heart from inside. So it covers the atrium, ventricle, the valves, septum from inside. It is simple squamous epithelium, don't forget. The myocardium formed of connective tissue which contain the cardiac muscle we already described in the previous slides. What about the valves of the heart? The valves of the heart is that separate between atria and ventricles, or between the ventricles and the aorta, ventricles and pulmonary trunk. The valve is formed of dense fibroelastic connective tissue covered by endocardium. Don't forget that endocardium is formed of simple squamous epithelium. Have a look here on the layers of the wall of the heart. This is the epicardium. Epicardium formed of simple squamous epithelium. You may find here another covering of the whole heart, which is called pericardium. So the pericardium and the epicardium, both of them formed of simple squamous epithelium. Here you will find the myocardium. It is the connective tissue that contain the whole cardiac muscle running in different directions: longitudinal, transverse, oblique, and forming one syncytium, act in one syncytium to pump blood, of course. Here you may find the endocardium. endocardium, also formed of simple squamous epithelium that line the wall of the atria, ventricle, septa, and valves. What is the difference between the cardiac muscle fibers and Purkinje fibers? Purkinje fibers are the conducting fibers that conduct the impulse from the AV node to the whole ventricle, either right ventricle or the left ventricle. The Purkinje fibers are characterized by being larger in diameter than the cardiac muscle. Compare here between the cardiac muscle, small diameter, and conducting Purkinje fibers, larger in diameter. Paler than the contracting fibers. It is eminent and clear here that the Purkinje cell or Purkinje fibers are paler than usual cardiac muscle fibers. Why? Why Purkinje cell is paler than cardiac muscle fibers? As it contains large amount of glycogen and few myofibrils. On the reverse, the cardiac muscle fibers contain large amount of myofibrils and smaller amount of glycogen. Content number 3, histology of blood vessels. Histology of blood vessels, I want to explain it in this diagram. I have here many kinds of vessel. I have the artery and veins and capillaries. Arteries, veins, capillaries. Each type of this category subdivided into 3 types. The artery, the first category is the elastic artery or the aorta. The second is the muscular artery. And the third is the arteriole, small artery. As regards the venous system, we have 3 categories. Large vein, like vena cava. Medium-sized vein, like the muscular veins. And the venule, which represents the small vein. Moving to the third category of the blood vessels, which is the capillaries. Capillaries, we have 3 types of capillaries. We will explain and elaborate in them after finishing the arteries and veins. Let's start by the general structure of any blood vessel. Any blood vessel is formed of 3 layers, and the layer in the blood vessel, like exactly what we said in the testis. The layer is called tonica, and the plural term is tonici. The singular term is tonica. We have tonica intima, in intimate relation to the blood. It is formed of epithelium called simple squamous endothelium. When it comes in contact with blood, we change the term epithelium into endothelium. Simple squamous endothelium with underlying subendothelial connective tissue. Subendothelial connective tissue, rich in connective tissue fibers. The second layer is the tonica media, middle layer, formed of circularly arranged smooth muscle fibers. Circularly arranged smooth muscle fibers. The third and last layer is the tonica adventitia, or the outer layer. It is formed of connective tissue layer. Connective tissue layer without epithelium. Here a great comparison between medium-sized artery and medium-sized vein. As regards the wall, the artery thick with narrow lumen and contains no valves, while the vein thin wall, wide lumen, and usually the vein, medium-sized vein, contain valves. Have a look on this diagram. This is the artery. This is the artery, thick wall, narrow lumen, while the vein, thin wall, wide lumen. Okay. Second point of comparison is to compare between the tonica intima. We call it intima as it is in intimate relation to the blood. In the artery, we have thick tunica intima formed of simple squamous epithelium with underlying elastic fibers together with internal elastic lamina. In the reverse, medium-sized vein, the intima is thin, formed of simple squamous epithelium also, few elastic fibers, and no or absent internal elastic lamina. Have a look here. This is the intima here, and this is the internal elastic lamina. While here, the intima present here without internal elastic lamina. No internal elastic lamina. Here you will find elastic fibers appear in blue color, but here few or no elastic fibers in the intima. Okay. Moving to the second layer, tunica media, or the middle layer. In the medium-sized artery, we have thick media formed of circularly arranged smooth muscle fibers and elastic fibers. External elastic lamina also present in the medium-sized artery. Medium-sized vein, tunica media, formed of thin layer, few circularly arranged smooth muscle fibers and few elastic fibers. No elastic lamina, no external elastic lamina. So the vein contain few elastic fibers, no external or internal elastic lamina. Look at this. This is the tunica media, circularly arranged, well-developed smooth muscle with elastic fibers, but here tunica media thin, and with few elastic fibers, few or no elastic fibers. Last layer here is the tunica adventitia, which is thin or thinner than the media, containing elastic fibers, but in the vein, the adventitia thicker than the media and contain collagenous fibers. It is very clear here in the diagram. The adventitia is thinner than the media in the artery, while the adventitia is wider or thicker than the media in the vein. Microscopic examination, the artery under the microscope, here you will find thick wall, narrow lumen, while the vein is thin wall and wide lumen. Now, to compare between aorta and inferior vena cava, the large vessels, aorta and inferior vena cava. By the same rules we already set when to compare between any blood vessels. We have the wall, lumen, tunica intima, tunica media, tunica adventitia. The wall thick, inferior vena cava, the wall is thin. Lumen, as all of them are large vessels, so the lumen wide here and very wide in the inferior vena cava. Tunica intima represent 10% of the thickness of the wall in the aorta, with presence of internal elastic lamina. Also, it represents 10% of the wall of the inferior vena cava, but no internal elastic lamina. Second layer is the tunica media. Tunica media, thickness very thick in the aorta, represent 70%, formed of many elastic laminae and few smooth muscle, circularly arranged. So don't forget that the aorta, media of the aorta, formed mainly of elastic laminae. While in inferior vena cava, we have only smooth muscle fibers, which is circularly arranged. Look at this diagram. This is the intima, 10%. This is the intima of inferior vena cava, 10%. The media here, 70% of the whole thickness. The media here is only 20% of the whole thickness of inferior vena cava. In the aorta, we have many elastic laminae and few muscle fibers, while here in the inferior vena cava, we have smooth muscle fibers with few elastic fibers. The last layer is the tunica adventitia. In the aorta, it represents 20%, while in inferior vena cava, it represents 70%. It is formed in the aorta of elastic fibers and vasa vasorum. What is the meaning of vasa vasorum? Think in what is vasa vasorum and try to answer this activity. Longitudinally arranged smooth muscle present in the inferior vena cava. This is the characteristic of inferior vena cava. The adventitia in inferior vena cava contain longitudinally arranged smooth muscle fibers, but also contain collagen and vasa vasorum. Look at this. This is the adventitia in the aorta. 20% contain vasa vasorum and elastic fibers. While here, the adventitia represents 70% in the inferior vena cava, formed of bundles of smooth muscle fibers together with collagen fibers and vasa vasorum. Last item today is the types of capillary. The capillary characterized by being thin-walled tubular blood channels. It is the site of gaseous exchange, nutrient exchange. It is the site where all nutrition and gases pass to the cells. It connects between the artery and vein, the arterial system and venous system, namely the arterioles and the venules. It conducts blood from the terminal arterioles to venules. Diameter of the capillaries 8 to 10 micrometer to allow passage of red blood cells. The red blood cells was 7 micrometer. This is the artery coming the blood, oxygenated blood. It will pass to the arteriole and then to pass to the capillary network, then back to the venule and back to the vein, which here contains the valves. As you see here, the veins contains valves in their wall. This is the wall of the capillary. Let's investigate and examine the wall of the capillary under the microscope. Histologically, it is formed of single layer of endothelial cells rolled up to form tube. Single layer of endothelial cells rolled up to form tube. The tube resting on basement membrane. Look at this basement membrane. The cytoplasm here contains the usual organelles together with the nucleus. Cytoplasm of endothelial cells contains the usual organelles. Here I have two types of capillaries. Continuous capillary, which is closed by tight junction here, and the cell and the basement membrane continuous. While here the second type of capillary, which is fenestrated, contain fenestry or pores. You see the pores here? This is the pores, fenestrations or pores, allow passage of hormones, passage of nutrition, and so on. Cells or the endothelial cells are connected together by occludent junction or gap junction, zonula occludent and gap junction here. This is the tight or occludent junction. And this is the basement membrane, the endothelial cells resting on basement membrane. Between the basement membrane and the endothelial cells, I will find here this cell. This cell is the pericyte. The pericytes lay between the endothelial cells and the basement membrane. Pericyte is stem cell that can differentiate to any kind of cells. Pericyte can differentiate to replace the endothelial cell. Pericyte also can differentiate to replace any connective tissue cell, like fibroblast, like mast cell, like reticular cell, and so on. Types of capillaries, 3 types of capillaries. Continuous non-fenestrated capillaries present in the muscle tissue, connective tissue, nervous tissue. This is continuous in all things, continuous basement, continuous endothelial layer. While continuous fenestrated fenestrated, contain fenestrae. If you clarify here, if you investigate clearly this, you will find the fenestrae. Fenestrae pores of the same size present in the wall, but still the basement membrane is continuous. Present in the kidney, present in the intestine, and into endocrine glands. The last type is the sinusoidal capillary or sinusoids. The basement membrane here is discontinuous, and the endothelial cells also contain irregular pores, irregular gaps, irregular pores. And this type of capillaries present in the liver, spleen, and bone marrow. Liver, spleen, and bone marrow. What is the characters of continuous non-fenestrated? No fenestrae in the endothelial wall, continuous basement membrane. While in continuous fenestrated, you will find continuous basement membrane and fenestrae within the wall of the cell. Sinusoids here, discontinuous, multiple large irregular openings in the endothelial wall, discontinuous basement membrane. Here the comparison between the three types of capillaries. We have continuous capillary here, fenestrated with fenestrae here, and sinusoidal with irregular gaps here. Assignment in table form compare between the aorta and inferior vena cava, medium-sized artery and vein, continuous and sinusoidal capillaries. I think this lecture can be summarized by some of comparison. Let's have some activity here. MCQ question. The Hiatt system is located at of the sarcomere in cardiac muscle fibers. In your opinion, it is located at, yes, at Z line, exactly. A 54-year-old male patient came to the clinic, suffered from headache, fatigue. On examination, the blood pressure was 180/110. Which of the following vessels is greatly affected in his condition? The most affected blood vessel is the muscular artery. Yes, muscular artery. The capillary not affected by hypertension. Venule not affected. Inferior vena cava not affected. Lymphatic vessel not affected. Only the muscular artery which is the effect. Capillary with discontinuous basement membrane and large opening in the endothelial wall is located. You will think the discontinuous basement membrane and large opening is sinusoidal type. Sinusoidal type present in the bone marrow. Yes, exactly. Intercalated discs are formed of, yes, which type of junction? Yes, it is formed of cell junctions and desmosome. Yes. Namely, it is formed of occluding junction, desmosome, and gap junction. The most important one is the gap junction. Answer is number D. A 21-year-old female show normal structure of her valves of the heart. The core of the tricuspid valve in this woman is formed of, yes, fibroelastic connective tissue, and covered by simple squamous epithelium. So the core or the center formed of fibroelastic connective tissue and covered by simple squamous epithelium. The answer is A. Thank you for all of you. I hope it was clear for all of you. I hope it was beneficial. See you again.